Hello friends, today we'll discuss about some of the important clues. So with these clues you can easily make the diagnosis. So first the given question here is a patient presents with pharyngitis or sore throat and there will be a sandpaper feel like rashes, or they given like strawberry tongue and pastille lines which is usually seen in the skin fold, okay, that is in the elbow region or behind the knee region or near the gluteal folds. So if they have given a history like this, then it is nothing but it is an scarlet fever actually, so which is usually caused by streptococcus pyogenes, okay. So that is, it is in group A streptococcus. And so these are the important clue words you want to remember here. So coming for second question, there is history of purpuric rashes, shock and disseminated intravascular coagulation, and then adrenal hemorrhage, and there will be a history of an MODS, that is a multi-organ dysfunction, okay. So if they are given a history like this, so bilateral adrenal hemorrhage and shock and this rashes, it is nothing but it is an Waterhouse Friderichsen syndrome, okay. So which is caused by Neisseria meningitis, okay. So if you come across bilateral adrenal hemorrhage and then rashes, so again friends, just a point to remember, this question has been asked in the previous year, okay. So coming for third question, so given the patient presents with tonsillar swelling, neck edema, and then foul breath, stridor, and then there is an what is the change of the voice, and then pseudomembrane, okay. So here the important clue is for you is a pseudomembrane, and then this pseudomembrane usually bleeds on removing, okay. So if you come across this clue, it is nothing but the organism is Corynebacterium diphtheriae. So coming for fourth question, if the history of any neonatal meningitis or the sepsis, if they given option like any streptococcus, okay. So if you come across any streptococcus family, then it is in streptococcus agalactiae. If they have given any other like listeria also, then you want to rule out that. But there is some of the specific clues for listeria, which I will be covering in the upcoming topics. So but here for time being, you want to remember neonatal meningitis and sepsis is streptococcus agalactiae. So next question, if they given history of splenectomy, sickle cell disease, or any hemoglobinopathies, okay, like thalassemia, etc. If you come across the option streptococcus pneumoniae, you can mark that. So because what happens here is, in these conditions there will be a defective spleen, okay. The spleen is a home for destruction for the capsulated organism, okay. So if you are coming across these histories, you can mark out streptococcus pneumoniae. So provided you want to rule out the other options, okay. So here this will be clue so that you can make out the diagnosis. So coming for next question, history of papule. This papule get develop into a vesicle, and then it develop into one black necrotic eschar, and then there is a non-pitting indurated edema, okay. So as you know, if you come across the black eschar, you can rule out two things. One, it is in scrub typhus, another it is in what is it, bacillus anthrax. So here there is a presence of non-pitting indurated edema, and then in this question there is no any history of any bites, okay. So if they have given any history of bite, or the patient or the person went into some of the forest, then you can go for the scrub typhus. But here they didn't given any history of bite, etc. So you can make out it is in bacillus anthracis, okay. So coming for next question, yeah, this is an easy question. History of Chinese fried rice intake, and then patient presents with vomiting, abdominal pain, diarrhea, and the fever. When you come across the word Chinese fried rice, Yeah, it is nothing but it is a Bacillus cereus. So again, if they given any about the Chinese history, and then if you come across a parasitology, then it is usually they have given the cholangiocarcinoma, then it is a Clonarchus sinensis. So I'll be covering in upcoming videos for just. So next question, history of wound contamination, pain, foul smelling, thin serosanguinous discharge, and then there is a crepitus. So in this the wound contamination, in the sense there will be history of any RTA. Okay, so the patient had a swelling and then he developed in discharge, and then there's an examination, you can find out a crepitus. So crepitus is nothing but it is an what is it, you know, right? It's a sound like a gas bubble which gets breaks. Okay, so yeah, it is. If you come across a wound history and crepitus, you can make it as it is a Clostridium perfringens. That is, this is a history of nothing but it is a history of a gas gangrene. Okay. So what are the other agents causing gas gangrene? One is perfringens, another is Clostridium novae, and another is Clostridium septicum. But I'm sure they won't give this and all. Okay, there will be an option will be perfringens, the most common cause for causing the gas gangrene. So you no need to confuse the rest of the points. So coming for next, it is a history of delivery conducted at home and abnormal spasm of muscle and spastic contraction of an extensor muscle. So this is nothing but, so the abnormal spasm of facial muscle is nothing but it is in rhizus sardonicus, and spastic contraction of extensor muscle is nothing but it is in opisthotonus, no. So these are the here the clear history is delivery conducted at home, means it is delivery has been conducted at an unhygienic place, and so that the patient get infected. So the baby chances of getting a tetanus, that is here the organism is Clostridium tetani. So as you know, the Clostridium tetani, that's a specific the spore arrangement, that is it is a drumstick appearance, you want to remember that. Okay. So again here in RCM broth it usually shows a proteolytic, you know, so proteolytic it is means it is in black color. Whereas rest of the species, perfringens, what is a difficile, everything will be causing an sacrolytic. Okay, but here this tetani, it is somewhat an exception which usually causes an proteolytic. So coming for next question, the final question, history of diplopia, dysphasia, decreased deep tendon reflexes, constipation, and descending symmetric placid paralysis. As you know, there is a 5D, 1, 2, 3, okay, so it's a 5, what is another disease? It is R3 or 2. So if you come across this, then it is a Clostridium botulinum. So friends, you want to remember here, this is a only food poisoning which usually causes in constipation. So generally all the food poison is usually manifested with diarrhea, right? But here there won't be diarrhea, instead there will be in constipation. So you want to remember this, that is the causative agent here is it is a Clostridium botulinum. So if you come across this point, you can make out it is a Clostridium. So friends, I think this is session 1. So I'll be covering like a clinical clues to make a easy diagnosis in the upcoming session. So this will be useful for your examination too, to make the quick diagnosis. So stay tuned friends. Okay, so thank you.